We know that 1 out of 4 people will have low back pain in their lifetime. A lot of the back pains people have are just muscle sprains, a little overwork, a little extra weight. And I think there's so many causes, but what we're looking for is by the time you see a neurosurgeon, you've had some physical therapy, you've had conservative therapy. Think about if you have 1 pound in your front belly, it's 4 pounds on your back. So after you've gone through all this treatment, then you've gone through that you don't have any tumors or stuff, then we look at other causes of pain. We look at, is it bad disc, is it bad facets, is it bad joints? And that decides how we treat it. Remember, only 1 out of 8 to 10 people that we see ever need surgery. So that's why we'll have physical therapists, chiropractor, see the patients. And then we deal with their back pain and say, what can we do? And one of the new things that we have really started to do in the last 2 years, a lot of people there's a joint in the back called, and that has a nerve that serves no purpose. So a lot of the pain doctors would actually do the injections and then burn the nerve, and they have to come back every 9 to 12 months to reburn the nerve. But in our case, what we can actually do is after we do the testing and prove it can work, we can actually come with a scope and burn and cut the nerve, and it never regenerates. And you never have to go through that again. So that's something that we can do when you have anesthesia and you go to sleep and you're discharged in 2 hours. So I think that's one of the treatments. We also people have disc herniations that can cause leg pain. And that's the one then we may need to do after injections, which we do ourselves. We may have to do the surgery. So there's a whole things of armamentarium that we do for low back pain or people with neck pain and arm pain.